A reverse chip is a type of shot in the game of field hockey. Although most of the motion seems to be generated from the arms, all of the power for the shot comes from your legs. Because of how key the legs are to successfully doing this shot, we will be focusing on the movement in the lower body. In the starting position, there is flexion in both knees and the hips, along with a slight inversion of the left foot. The knee is a synovial, modified hinge joint that moves along one axis. Flexion in the knee decreases the angle between the distal end of the femur and the proximal ends of the tibia and fibula. The hamstrings are the agonists in knee flexion. They contract and are the prime movers. They include the semimembranosus, which originates at the ischium and inserts on the medial side of the tibia, the semitendinosus, which also originates at the ischium and inserts on the medial side of the tibia, and the biceps femoris, which originates on the ischium and inserts on the lateral epicondyle of the tibia and the fibula. The quadriceps are the antagonists in knee flexion. They lengthen so the knee can flex. This group of muscles includes the vastus intermedius, which originates on the femur and inserts on the patella and the tibial tuberosity, the rectus femoris, which originates at the ilium and inserts on the patella and the tibial tuberosity, the vastus medialis, which originates at the femur and inserts on the patella and the tibial tuberosity, and the vastus lateralis, which inserts at the femur and inserts on the patella and the tibial tuberosity. The sartorius, originating at the lateral iliac spine and inserting on the medial side of the tibia, is also an antagonist in knee flexion. The hip is a synovial ball and socket joint, allowing it triaxial movement. Flexion of the hip brings the proximal end of the femur closer to the ilium and involves the iliopsoas and the rectus femoris as the agonist. The iliopsoas originates at the ilium and lumbar vertebrae, and the rectus femoris originates and inserts as noted prior. The gluteus maximus is the antagonist in hip flexion and originates at the iliopsoas and inserts on the ilium and lumbar vertebrae. Here, the left foot is slightly inverted, moving the foot closer to the midline of the body. The ankle is also a synovial hinge joint, again allowing it uniaxial movement. The agonist of the inversion of the foot is the tibialis posterior, which originates at the tibia and fibula and inserts on the phalanges. The antagonist for this movement is the fibularis longus, which originates at the tibia and fibula and inserts on the phalanges. There is continued flexion in both knees with the same muscles as noted previously. There is slightly more flexion in the right hip, but the muscles involved in the movement are still the same as before. There is plantar flexion in both feet, which increases the angle between the tibia and the fibula and the phalanges. The agonists are the gastrocnemius, whose origin is the femur and insertion is the Achilles, soleus, which originates at the tibia and fibula and inserts on the Achilles, the fibularis longus, which originates at the tibia and fibula and inserts on the phalanges, tibialis posterior, whose origins are the tibia and fibula and insertion is the phalanges, and the flexor digitorum longus, which originates at the tibia and inserts on the phalanges. The antagonists are the tibialis anterior, whose origin is the tibia and insertion is the phalanges, and the extensor digitorum longus, which originates at the tibia and inserts on the phalanges. There is continued flexion of the left knee and hip, involving the muscles as noted in the starting position. Now, however, there is dorsiflexion in the left foot, decreasing the angle between the phalanges and the tibia and fibula. Once again, the ankle is a synovial hinge joint that moves uniaxially. The agonists of this movement are the tibialis anterior and the extensor digitorum longus, the origins and insertions of which are noted in frame 2. The antagonists of this movement are the fibularis longus, the gastrocnemius, the soleus, tibialis posterior, and flexor digitorum longus, the origins and insertions of which are also noted in frame 2. The left foot is also slightly everted, pulling the foot away from the midline of the body. The agonist is the fibularis longus, while the antagonist is the tibialis posterior. There is extension of the right knee, which increases the angle between the distal end of the femur and the proximal end of the tibia and fibula. The quadriceps, including the vastus intermedius, the rectus femoris, the vastus lateralis, and the vastus medialis, along with the sartorius muscle, the origins and insertions of which are noted above, are the agonists of knee extension. The hamstrings, which include the semimembranosus, semitendinosus, and biceps femoris, the origins and insertions of which are also noted above, are the antagonists of knee extension. Extension of the hip increases the angle between the proximal end of the femur and the ilium. The agonist is the gluteus maximus, which originates at the ilium and inserts on the iliotibial band and femur. The antagonists are the iliopsoas, whose origins are the ilium and lumbar vertebrae, and insertion is the femur, and the tensor fascia lata, which originates at the ilium and inserts on the femur, and the iliotibial band, which has an origin of the ilium and an insertion of the tibia. There is also plantar flexion of the right foot, which involves the same muscles as noted previously. There is flexion of both knees, the same as discussed before, along with slight inversion of both feet, slight flexion in the hip, and plantar flexion in the left foot as it drops back down onto the turf.